and resident rights. I want to try this one more time because it makes it so much easier for me to give you credit. So I have color-coded the sign-in sheets because it still wasn't happening. So, if I can put on a pair of glasses. There we go, look at that. This is rehab. If you do not work in rehab, please do not sign this sheet. Okay? This is for nursing. Anybody who has a CNA license or a nursing license, please sign in on this sheet. If you do not have one of those two things, please do not sign in on this sheet. This is for dietary and environmental services. If you do not work in those departments, please do not sign on this sheet. This is a huge help for me and for you to get credit quickly for attending these in-services. Thank you so much, I appreciate it.
Good evening. Thank you.
I answered it twice. Oh. I was in the
I had to hold on to the left hand.
And then this is what I'm going to bring out.
I'm proud of my life.
It's hard to talk through the muffle, so I'm 6 feet away. I have proper social distancing here. Everybody else wear your mask if you're not 6 feet away from anybody else, unless you're eating, of course. It's very hard. Yeah. Okay, we're going to get started here because we have a lot to talk about. We're going to do our required in-services. We're going to do them quickly. We're going to do advanced directives, we're going to do resident rights, and then we're going to do our COVID-19 update. And we have Adam here also to help us with the COVID-19 update. So this advanced directives, this is one of our documentation tools for advanced directives, and I thought it would be good to just go through it so that you guys, and if you give me all the answers, then we don't have to go any further, you see. So advanced directives, these are the different kinds of advanced directives that you can have. You can have a living will. Somebody tell me what a living will is.
Your wants of what happens, your wish, documents that you end up being coherent and what you want to happen with your funeral and all your stuff.
Okay, it actually doesn't have to do with that's a will. This is a living will. So a living will is a legal document, somebody said that over here, and it tells you what you want to happen to you should you become incapacitated and can't tell anybody, but this is what I want right now. So I would not want artificial nutrition, I would not want heroic means, you know, I don't want to be on a ventilator for a prolonged period of time. That's what a living will tells you. So there's some very detailed living wills, and there's not so detailed living wills. Who can fill out a living will? Anybody. Anybody can fill out a living will. That's right. If you guys want a living will, I have one. You guys know that, hear that, okay? I have a living will. Tell them to go find my living will. So you can fill one out online. You can get a blank copy. You can get them as detailed as you want them. They can be 20 pages long. They can be 1 page long. But and it depends on how detailed you want to give your instructions. Okay. Now, if somebody has a living will, but they're alert and oriented, this is a trick question, and they're alert and oriented, and they give you direction that's different from the living will, which do you follow? What the person wants. That's exactly right. The person's choice as long as they're alert and oriented. And that is, we go by the BIM score. So the BIM score, according to the federal government, if you have a BIM score that's greater than 11, you can make medical decisions for yourself. For yourself. So what is a healthcare surrogate? So a healthcare surrogate is somebody you appoint to make healthcare decisions for you.
And that you become compassionate.
Okay.
I had to do it for you.
What's that? No.
It's which, for an event when they become, where they can't make their own decisions right then and there at that moment.
That's right. So sometimes somebody will appoint a healthcare surrogate, but they're still alert and oriented. If they're still alert and oriented and they appoint somebody else's healthcare surrogate, who do you listen to?
Patient.
What's that? No, the patient.
Well, yeah.
If the patient is still alert and oriented, they still make those decisions. Because we have a lot of families that come in here waving those durable power of attorneys in my face, saying, oh, but I have power of attorney, so Dad can't go outside and smoke. No. Or Dad can't eat that, or this. He can't have that cake. No. If Dad is alert and oriented, Dad makes those decisions for himself. Yes, sir.
In this case, what happened with my mother, my sister in Australia was a healthcare surrogate. She was in the hospital, and she did not do the living will, but however, that she never showed up until she would. Doesn't the person that has a healthcare surrogate have to show up?
They don't have to show up, but they have to participate. They don't have to be there in person, but they have to participate. So they have to be available. And once that time comes, they have to accept the appointment of the healthcare surrogate. So if they don't, then there's other things that we follow. So the state of Florida has, instead of a surrogate, if somebody is not appointed a surrogate, and they don't have any, we don't know who needs to make healthcare decisions, we can appoint somebody as a healthcare proxy. Now, the state of Florida has decided that proxies follow a certain, the spouse is first. So be careful. If you don't like your spouse, then appoint a healthcare surrogate. Because when you become incapacitated and you don't have a healthcare surrogate, they're going to appoint the spouse first. Next, after the spouse, are the children. And it goes in order from oldest to youngest. So if you don't like this order, in other words, if you don't have a spouse and you don't think, and your oldest child has been backpacking all over Europe for the past 30 years, well, maybe not. Think about it. Think about it. So it's best to make those decisions yourself rather than somebody else making them for you. But there is a very definite pecking order according to the state as to who we can appoint first as healthcare as proxy and who second, third, fourth on down the road. Power of attorney for financial only. What does that do?
Someone's in charge.
That's exactly what it says. That's right. They cannot make healthcare decisions. No. Durable power of attorney and both, which would be both for healthcare and for financial, Now, when you sign for somebody to, like when you get a new car, you always sign a power of attorney financials to have somebody else get those tags and titles and things like that for you. Be sure that it's limited to those functions. You don't want them taking that to your bank and doing what they want there. Okay. Do not resuscitate order. What does that mean? Let me die. If
You're not in emergency.
what's that?
No, if you're in an emergency. you
If
don't
the
have
heart stops, you do not do CPR. That's exactly right. If the heart stops, you don't do CPR. That now, a do not resuscitate is not a do not treat, or do not hospitalize, or do not do anything else. It simply says if the heart stops, you do not pound on the heart.
However, if it's in the home and it's not pasted on the refrigerator, when EMS comes in, they can do it.
Yes.
Oh, yeah.
Yes, so that's different. So here, do not resuscitate. Is the yellow form required?
No.
No. Right, the yellow form is only for EMS. Who said that? Good job.
What about
Good
general
job.
transport?
No, the yellow form is not required. It's just for us. It's the yellow form. The yellow form is for EMS only.
We had a leopard came here to pick somebody up to go to a hospital, and they asked, leopard, sorry, they asked for the yellow form, not the other.
Okay, well, they didn't realize that the regulations don't apply to them.
We gave it.
And that's fine. That's fine. Yes, so it doesn't apply. So we do not, a yellow form is not required here. So if somebody rolled up to me and said, if Annette here says, I want to, Debbie, if I should stop breathing, don't resuscitate me. What do I do then?
You have to honor it.
You have to honor it. I heard that somewhere.
Give her a form, sign it.
That's right. Give her the form if she's able to sign it. What if she's not able to sign it? Or you don't have the form?
Still have to.
You get a witness, good. And then you write the order on the chart for do not resuscitate because that's what her wishes are. So the state of Florida and CMS, I actually have the do not resuscitate guidelines right here. And it says throughout here, it only talks about the patient's wishes. So whatever the patient's wishes are, that's what we do. Regardless of, and they don't need a doctor's signature. Do they need a doctor's signature to be a do not resuscitate?
No.
No. Good thing. We don't need a doctor's permission to make choices, right? Yes, sir.
In the villages, some brilliant retired lawyer came up with this plan. You know the heart thing where they have to start it again? You know when they come in and
They shocked it.
they shock it.
Uh-huh.
Well, each paid $125 to have this close by when EMS will come. And the lawyer said, if we know a patient needs this, we could break down the door, go in and give it to him. Now, like how?
Okay, so we're just talking about here.
and nobody, you can't.
So, yes, ma'am.
So if someone is deemed incompetent,
Yes,
say, I don't want to resuscitate, but they're deemed incompetent.
right.
So what do we do in a situation like that?
Well, then we go to their healthcare survey. Yes. So they have to have capacity to make any of these decisions. And according to CMS, capacity is a BIMS above 11. Now, that's not a lot of capacity. We all know that. But that's what they say they need in order to be able to make healthcare decisions for themselves, is a BIMS above 11. So any questions about that, about CPR? And when we do it, and advanced directives, and do not resuscitate. So this, the BIMS is completed by therapy, but it can be completed by social services if we need to know, or by nursing if we need to know, if we want to know what it is right then and there. We do it on every patient on admission, and it's in their, look under assessments, and you can see what their BIMS score
Okay,
is.
so at night we can do that.
You can always look at that. So we need to get a code status on a patient upon admission. We shouldn't go any amount of time without a code status, because we've had patients take them off the stretcher and they coded, right? And so we need to know right away what we're supposed to be doing with them.
Can't we put it in the room or something? I'm not gonna have time to go and look on here. Oh wait, I gotta see if I can bring it back. I mean, isn't there some way?
And you just take a minute. Actually, you can
I'll float
also
around, I'm not gonna look up and get 3 minutes.
you can also look in the hard chart. When you pull it out, there's a green or a red sticking out form in there. Green means go, red means stop.
It's under the yellow tab.
It's under the yellow tab in the hard chart.
I don't even know where that's at.
And where they keep the hard charts.
Okay, so I gotta.
In the
I
cabinets.
gotta do that every floor I go to.
You do.
Alright.
Yep.
Is it
Yep.
in the room?
And you know, when somebody, let's go over that. So somebody stops breathing in the room. Carla, you're in the room. And somebody stops breathing, boom. What are you gonna do?
Start CPR, yell for help.
Yell for help first. So then, and let them know that they've stopped breathing so that they can check the chart. Somebody's gonna be down there, or somebody's gonna, so they can run down, check the chart. You have to check first. In those few seconds, isn't gonna mean anything that you need to check. And then yell for somebody, if they're a full code, yell for somebody to bring the crash cart and call 911. And then we need a whole team, everybody responds to the code. Somebody announces it overhead, code, room 56, code blue, room 516, or whatever it is, and then everybody comes and takes turns. And then we do compressions to staying alive, right?
So it's illegal to have it known, basically. You have to hide it in the chart, you can't put a band on or anything like that.
Well, it changes, so we want to be sure. Because now, what if somebody is a DNR and then comes up to me and says, I don't want to be a DNR anymore, then what do we do? You change it, right then and there, and be sure to get the order out of the chart. Right. Okay. You want to do resident rights? Any further questions about advanced directives? I think we've done this so many times that you guys are.
Okay, hi everybody. Hi. So resident rights, everybody have one of these papers? Did everybody get one? Frida was so kind just to print this up and fold it and make it look really nice. I appreciate that. So these are the resident rights according to section 400.022 of the Florida statute. And this tells us what rights the residents have. So they have the right to civil and religious liberties, which means that they have the right to vote if they're able to vote. And they also have the right to worship or not. So we try to provide them with, access to religious services if they so desire. Private and uncensored communication, so they all have access to a telephone. And most times nowadays, they all have cell phones too. So they can be visited by any individual, providing health, social, legal, or other services, and the right to deny or withdraw consent at any time, except now, thanks to COVID-19. Yeah, that's been restricted. So they have the right to present grievances and recommend changes to the policies and services. They should be free from restraint. We are a restraint-free facility. We do not have any type of restraint here. Interference, coercion, discrimination, or reprisal. So that means if they make a complaint, we have to address that, and we don't discriminate against them or make them feel bad because they had a concern. And it includes the right to have access to the ombudsman and other advocacy groups. And the ombudsman is a group that advocates for, and they're all volunteers, they advocate for elderly, and they can call them, and the numbers are posted for there. Also for the ACA and an abuse hotline is also posted. They have the right to organize and participate in resident groups. So if they want to start a you know, a poker club. They just can't, you know, they can have one. We're just going to help them. And participate in social, religious, and community activities that do not interfere with the rights of others. So we just always have to make sure that whatever one resident is doing is not technically interfering with the other person's rights. I think we do pretty well with that. Examine results of recent facility inspections. Ours is posted at the front. And I'm not sure, but it is on the front desk up there, so they can see that. And also to our plan of correction, what we say, if something was wrong, what did we say we were going to do about it? So they can have the right to look at that. Manage his or her own financial affairs, which we've discussed here. A quarterly accounting will be furnished to resident or legal representative. We don't do a lot of long-term care here, so refuse medication and treatment and to know the consequences. So if a patient says, I'm not taking that, they have a right to say that. You can just tell them, okay, I understand you don't want to do this. Do you understand what could occur if you don't? And if they say, I don't want it, you say, okay. You can always reapproach, but it's their right to say no. So we shouldn't get all upset. Because as nurses and as, you know, caregivers, we want them to do what we think is best. But sometimes they don't think it's the best, so we have to follow their wishes. They have the right to be fully informed in writing and orally of all services available at the facility and of related charges for such services. And we do have a book in the room that has a list of all the services that's provided. Social services goes over all of that with them, and they have an admissions meeting, and they go over all those documents and all of that. And then there's a book in there that says we have hairdressers, we have pictures of all of the department heads, and et cetera, et cetera. So we do provide that. Receive adequate and appropriate health care, protected and support services within established and recognized standards. That's pretty self-explanatory. We provide them with care based on state and federal guidelines. That's what we do. Privacy and treatment and caring for personal needs. Knock on the door, close the curtains. Don't do things out in the open. That should be done in private. Be informed of medical condition and proposed treatment and be allowed to participate in the planning. We have care plan meetings. And if they'd like to have an additional one, they can request it and that'll happen. Be treated courteously, fairly, and with the fullest measure of dignity. So that's our responsibility. Treat everyone with dignity and respect. Hopefully the same way that you would want to be treated or your family member to be treated. Be free from mental and physical abuse, corporal punishment, extended involuntary seclusion, and from physical and chemical restraints, except those ordered by resident's physician. So if somebody's acting up and you want them to have 300 milligrams of Ativan, that's for chemical restraint, we're not going to do it. So when you're asking for those things, understand that it's not just about physical restraints that we don't do, but it is about certain medications that will cause the patient to not be able to do what they would normally do, and that's considered a chemical restraint, and we do our best, our very best, unless they're going to be a harm to themselves, and we try to not do those. We do not do those. Be transferred or discharged only for medical reasons, the welfare of other residents, or non-payment of a bill. Receive a 30-day written notice of discharge or relocation and challenge such a notice. I don't know that that happens that much, Deb, but choose a physician and a pharmacy. So we do that here. If the patient wants to change their doctor, all they have to do is ask, and we just let the attending that's on know, and then we ask the physician that they would like to have, if they would accept the patient, and if they say yes, then the transfer's done. Retain and use personal clothing and possessions. We encourage that here. We're a rehab facility, so we like for them to have their own clothing. and we want them to wear it. So we do encourage that. Have copies of rules and regulations of the facility. I think we have that. And information concerning bed hold policy for hospitalization, and I don't think we don't do bed hold except, right, Deb? We don't do bed hold. We have, yeah, we don't have
We
bed
still
hold.
have to do the form.
We still do the form, but we don't do, yeah. Okay, anybody have any questions about resident rights? Okay, y'all get credit for this. Thank y'all very much. Appreciate y'all.
A no lift policy? Wait a minute, don't go away, we're still doing Corona. We'll be quick. Okay, so come on up here, Adam. So we've got our Adam, everybody knows Adam Hunt. He's our administrator in training and also the epidemiologist for Ocala Regional. So we're fortunate to have him here, especially now. Most definitely. So I've been on many calls with the Department of Health. I have a call every Tuesday and Thursday. The ACA and CMS and the governor's office has, we have a call now every Monday, Wednesday, and Friday at 11 a.m. And then Advent Health every Thursday morning at 9 a.m. So we're getting constant updates. The rules are changing as we go. You know, some of the, so Adam, you want to do it? Okay. You don't need it, all right.
How's everyone doing today? Good. First off, give yourselves a round of applause for being here. You can do better than that. Outstanding. One of the reasons why I say that is you guys stay here so folks can be safe out there. It's highly important.
I can't hear what we're just saying.
Come a little closer. All right, so you guys can understand how this works. If you guys want a good conversation and you want to hear how this works, we can't have sidebars. All right? We're going to make this as easy as possible so you guys kind of understand how it works. All right? Does anyone know how many strains of coronavirus there is?
6.
There's 7. All right, good job. Good guess. Good guess. All right. Sometimes you hear the word COVID-19. It may refer to you to think in mind to say there's 19 different strains. I've heard that a million times walking around here and on the outside. That does not mean that. All right? This is a new virus. It was found in 2019. Hence why they put the 19 at the end of it, okay? Just real quick, I'm going to go through the, there's 4 common ones that are always transferred amongst humans. These are not deadly. They are out there. They're all over the world, okay? So when you see the word coronavirus, don't panic. All right, if you see it on an order or anything like that, you're not dead if you see that on a particular piece of paper. Right now, that you guys may have noticed that designation before, saw it, skip right over it. Now that it's in the news, it's in the media, it's on almost everything you read, everything you hear on the radio, it causes panic. We don't want that, okay? You're in a very safe environment being right here at the facility. The facilities are some of the safest environments you can be in. Why would I say that? Here we go. This is all common sense, folks. How many folks in here pump gas or have a vehicle? Just about everybody, all right? You can get contaminated from pumping gas. You can wear whatever you like, ma'am, but these are droplets, all right? This is how it works. Simply this for all you guys. When you're out and about, you see folks with masks on, different things of that nature. Some of them might be wearing masks because they are sick. Some might be wearing masks because they think it's fashionable, or whatever the case may be. Practice social distancing, all right? If you do that, if you don't have a mask on or have a mask on, you're still at a safer rate, okay? 6 feet away. It's very, very important that you guys realize that. Now, if you're with your family members in your home and you're self-quarantining, or whatever the case may be, well, since you have a mask on, social distancing inside the facility, you're okay. Good choice over there. I see you pointing that out. All right. But to understand how this works, if you're home and you're self-quarantining yourselves, the immediate folks that are in your group, as long as you're controlling their movements or working with those folks, you're going to be all right. Okay? They did say by the government regulations, CDC, WHO, and the state of Florida, you can go out and exercise. We're not talking about running marathons in a whole group like this. We're talking about keeping the groups as small as 3 to 4, okay? Taking walks around. Why is that good? There is treatment that's out there and states facts that are out there that vitamin D does help fight the coronavirus. What's the greatest source of vitamin D? Sun. Outstanding, all right? Unless you're a night runner, I don't know if the moon gives off vitamin D. But you have to understand how this stuff works, okay? There are statistical numbers out there that all you guys can be aware of and get the information at any relevant time. I would suggest you don't take the rumor from the neighbor across the street, okay? Or from some talk radio or NPR. I'm not saying those things are bad resources. Get it directly from the source, all right? If you didn't read it on the CDC website, you didn't get it from the WHO, any of the other organizations that are out there for healthcare or public health, it's probably a rumor, all right? I've heard some dandies since I've been here, okay? The reason why New York has the way they have it is because contractors with Chinese have come in and done work over there and they spread the virus. Straight foolishness, okay? These are things that people actually believe. If you didn't get it from the horse's mouth directly off of these particular websites that I mentioned, CDC, WHO, Department of Health in Florida or Department of Health overall, they're not true, okay? I did copy down statistical numbers for you guys so you kind of know what's going on and what's going on out there. Let's see real quick. I don't want to bore you. All right, total cases in the U.S. right now, as we speak, these numbers are updated by 4 p.m. every day Eastern Standard Time. In the U.S., you have 68,440 cases. All right?
Now, I have a question. That could be any strand of that corona, right? Not just those.
Negative. That's COVID-19 that they're
Oh,
tracking.
shit. Ooh.
So you're fine. All right.
Now,
Now, let's see.
how many people are in the United States, though?
Too many?
350 million people. Pretty close, pretty close.
All right.
That's registered people. We're not talking about undocumented and all the others, all right? So you understand, right now, it's almost under 1%, like 0.1 something of another of the deaths that actually happen in the U.S. Right now, currently, there are 994 deaths, all right? Compared to the rest of the world, we're doing okay, all right? Just believe that, keep that in your minds, and understand how the numbers work, all right? Every day they're testing. When they test, they're going to find new cases of people being positive, right? It's common sense. So we're going to watch the numbers climb. Do not panic, all right? Unless you're one of those ones that tested positive. Then you need to make sure you're self-quarantined and you go to the hospital or whatever you got to do, all right? In the jurisdictions of the United States, we're talking about Guam, Puerto Rico, Virgin Islands. There's only about 54 cases as of right now, all right? Quick fact for you guys to understand, with the population that we work with right now, 8 out of 10 deaths occur in the 65 and over bracket. All right? That's pretty high. That's about 80%. Okay? That's the folks who contract COVID-19 that are 65 and above. That's not counting the folks that are immunocompromised. Okay? So if you do have someone at home that's immunocompromised or things of that nature, a couple of things to practice. You're taught this when you're a CNA, you're taught this when you're a nurse. Get home, get to an area where you can be in private, disrobe, okay? Put that stuff directly into the washing machine. You're going to see a bunch of funny stuff on the internet, how to soak your clothes, how to wash your clothes. Nothing beats soap and water, all right? Put it in the washing machine, wash it, okay? They're talking about reusing masks, different things of that nature. Debbie has gone far above and beyond to give you guys masks when you leave and enter the facility. That is awesome, okay? You're not going to find that everywhere. You're not going to have that going on. You guys are in an added sense of protection with having the mask here in the facility. Why do you have the mask? Because you're protecting your what? Residents, okay? And each other, all right? Make sure you understand how that works. This is highly important. If you guys been beyond any of these rules or regulations, you're not only in jeopardy in your own lives, but you're in jeopardy in the lives of your actual residents. Not a good idea, folks. If we don't have them, you don't have what? Wow. Think about it that way. All right? Some other things for you to look at on the state level. These numbers are dated in real time. You can always go on these websites and find these. For the Department of Health in Florida, there are 2,355 cases in Florida. Okay? The numbers keep going up every day based upon the testing. All right? So do not panic. Again, the numbers will rise based on what? I didn't hear everybody say it. The numbers? All right, let me ask the question again.
So Adam, tell them how long they expect this to go on.
Okay, so right now, currently, on every phone call we're on and everything that we hear, they're looking at about 6 to 8 weeks for this to continue. Now remember, we don't know anything about this particular strain or this virus. We don't know if it's going to be seasonal. We don't know where the curve is or how these things work. We take the numbers directly from Hive. All right? So you have to be adaptable. You got to learn to adapt. Everyone in here, I see you adapting every day. It's great. Stay in that particular mind frame. Before things happen or they start to normalize and Corona becomes a part of our everyday life, then we'll feel a little bit better about it. But until then, you got to be versatile. You got to be able to adapt. All right? So, number of cases of death in Florida, does anyone know? No? Who said what?
29.
There's only 28 deaths total in the state of Florida. That is really, really good. Okay? These are good things for you to look at. No death is exciting, all right, or good. Not even if you don't like your spouse, it's still not good. All right? But we want to understand how this thing works, okay? It's almost less than 1%, all right? And that's really good numbers on the epidemiological side of things. We're going to stay hopeful with that, okay? Again, you're going to see a bunch of different connotations for the word coronavirus or COVID-19. The actual name for it, all right, genetically certified by its genomic name is SARS-2, all right? SARS-CoV-2. It is a derivative of SARS itself, all right? No need to panic with that. It's just some information for you guys out there. So if someone's walking around and say, oh, I got the coronavirus, they don't say they got COVID-19 or SARS-2 or whatever the case may be, give them 6 feet, and if they come closer, you keep backing up. All right? Don't put your hands on them. Don't do anything crazy. Yes, sir.
Aren't they working on 2 drugs that waiting for the FDC to and for the patients?
Yes. So he asked a very good question. Are they working on vaccines for this particular illness? Yes, they are. All right.
The CDC just released.
Yes.
So the CDC just released that the vaccine is not mutating fast, so they feel like they can, like the flu shot every year, develop a vaccine every year for this, and they hope to, of course, have one by next season, next year.
Very good.
They also have a gold standard, I think you were talking about, for treatment now. So they do have 2 drugs together that they're treating with. One's a drug that traditionally they treated malaria with, and the other one is a Z-Pak. But together they seem to buy enough time to build up antibodies, and it's really decreasing the severity and decreasing the length of the symptoms. So the CDC has pushed out now to all physicians that this is what you are to order.
And didn't they use the Ebola?
What's that?
At one point, they tried using the Ebola medication, and they say that helped in the severest cases.
I didn't hear that. The last call that we had was the one malaria drug and the one Z-Pak together for 5 days treatment, and so now they have limited that malaria drug to only people who tested positive for COVID-19.
Warfarin and Z-Pak.
Yes.
Very good. Now, when you hear these drugs, you're going to research them on the internet. You're going to see a lot of funny things with them. I'm here to tell you right now, do not self-medicate yourself. Do not do that. All right? I'll tell you why. They had an individual about a couple weeks ago. We found out that some of these same drugs exist in fish food. All right? And it says on the bottle, not for human consumption.
They drank the water.
Yeah, no, he didn't drink the water. He put like fish food in a spoon and he took shots of it. All right? That sounds crazy, but this is what humans do. All right? This is why this particular virus is spreading too, because of human behavior. It is very, very important that you guys understand, tell you what to do, try to act accordingly. If you can't, do your foolishness at home. All right? Do not do it within the facility. Don't do it where others can see.
By the way, that man died
Yes, he did die from eating fish food.
from trying to avoid the coronavirus.
That's what I was getting ready to say, make sure you got your living will made out.
Yes, yes. His wife did the same thing, self-medication, or self-medicated herself. She's in critical condition at the hospital. All right? Do not try to do these home remedies, okay? It's not a good idea. Now at this time, I'm just going to give you a couple minutes for some quick Q&A. You can ask me whatever you can. If I can answer it, I will. If I can't, I'll direct it to a source. Yes, ma'am.
I've got a question. It's not definite yet, but in about 6 months, my fiance might be put on the registry for a heart transplant.
Okay.
With these individuals dying, they can't harvest their organs, can they?
No.
That's a good question.
I'll tell you, until they actually get some guidelines along those lines, they're not touching those folks after they're gone. All right? They're not going to harvest their bodies. They're not going to take anything from them because we don't know if that's going to help pass the disease along. Okay? We don't want to do that to you.
I was just thinking, hey, we got a bonus prize here. I hate to say it, you know, I want him to get a heart.
Any other questions real quick? Yes, ma'am.
So what's the protocol if we suspect that someone may have it and they have like a fever that's uncontrollable and they're in a facility?
Like the patient himself?
Yeah.
Okay. Well, first of all, notify who? Yes. Notify your administrator, all right? Let them know you have a possible case in the building. I'm pretty sure CMS has guidelines on that. I will follow up with you with those particular guidelines. Remember, this disease is causing us to change a lot of rules, and really, really fast and on the fly. This is day by day, okay? We're going to have to use some common sense in here.
So what the Department of Health tells us, they do have written guidelines for this for Florida right now. So they tell us that they have to meet certain guidelines, this, and this. So they have to have shortness of breath, a fever for duration of more than 2 days, now over 100.4, and a dry cough, increased respirations, and decreased oxygen sats. If they meet that criteria with nothing else, no other reason for it. So nothing else diagnosed. In other words, they didn't have pneumonia and they were on antibiotics and it was helping and then it stopped helping and now we got to give them some different antibiotic. There can be no other reason. Then we contact the Department of Health. The epidemiologist then contacts Mary Alice. She tells them the symptoms, who it is, what it is, sends them all the information, and they actually come in and test and do the test themselves. And then that test, we get a special number for that test so that it can be accelerated, so that we can get the results back quicker. During that time span, we should put them on droplet precautions, so that, for a safeguard to be sure. According to the CDC, a negative pressure room is not needed. It needs to be just a private room, close the door, and put a mask on the patient, and everybody who goes in, gowns, masks, PPE, when you go in to see the patient.
But would it be surgical mask or N95?
So right now, the only thing available are surgical masks, so we use what is available. The surgical masks, as Adam knows, is not completely 100% foolproof, but it is better than not wearing anything at all.
So what is the chances of getting it from a resident that has been?
So right now, any patients that are sent to us are supposed to have 2 negative COVID tests before they come here. So they have that are 24 hours apart. And right now, I think all the patients that are going to the SNFs are using up all the COVID tests because there's a shortage at the moment, but we have priority because they want to get them out of the hospital. The emergency rooms are already overwhelmed. And they said on the call this morning, if you feel like you need to be tested, do not go to the emergency room. Please pass that around. The emergency rooms do not have any tests. But they're supposed to have 2 negative tests before coming into the facility if they have any of those symptoms. So in other words, Not if they're in and they had a fractured hip and they don't have any respiratory issues, they're not gonna have 2 tests. But if they're in for pneumonia, they're gonna have 2 tests. If they're in for anything respiratory-wise that it appears like they're having some symptoms, then they're going to have those 2 tests before coming in. If you use your personal protective equipment, then, you know, you should be safe.
So to reiterate, we're basically a safe house for...
We are clean. We are considered a clean. They have designated certain facilities that have a large number of empty beds as dirty. I know that's a bad word, but that's where they are planning on housing the COVID-19 patients, are in facilities that are either empty at the moment or have large wings where there's nobody there, and the state is actually taking over those buildings. But we have been designated clean. We're a community partner of, I believe, just all the facilities actually, and especially Advent Health and Central Florida Health. So we have a contract with them for surge. So what that means is that we might have to go over capacity in a surge situation. However, our patients that come, that have respiratory issues, will have the negative test before they come, but they might have to push out because they need those hospital beds. And in that situation, we will change the private rooms into semi-private rooms. You notice we've been hiring, between yesterday and today, we've hired 13 nurses and CNAs. A lot of them. Yes, ma'am.
So you're saying you change the private room to semi-private, like y'all had my room over there one time before? Yeah.
Maybe, maybe not. It depends. It depends on whether they need us for surge. We are hoping that's why they're thinking 6 to 8 weeks before we peak, because they're trying to flatten that curve. They're trying to flatten that peak. Because if the peak hits the way it hit in New York, they're going to run out of beds. They're going to run out of hospital beds. They're going to run out of places to put these folks. They've turned the convention center in Manhattan into a hospital, 1,100-bed hospital. And they have the National Guard right now staffing that hospital.
Is that cool?
Yes.
Okay.
Yes.
You work with 5 CNAs on each floor, right?
You're working with as many as it takes.
Okay.
That's why I'm hired.
Right.
Now, also and it may be not just CNAs, because they also, CMS put out guidelines on non-direct staff and what they're allowed to do. So everybody turns into a caregiver at that point. Therapists turn into caregivers, housekeepers turn into caregivers, but only what they're trained to do. So they can take orders, they can bring ice water, they can bring meals to people who don't need to be fed. They can do things that we're all going to be here to support each other.
So you get many hours more.
You can get as many hours as you want, yes.
All the time.
This is open.
So we have actually tested 4 staff members already, and all 4 have come back negative. So we have tested 4 staff members already, and we do have a way to test so that it's rapid. Now they have also developed a test that's 45 minutes only, but and also EMS is going to come in and randomly test our folks. Once they were hoping they would get enough tests to test all the employees, so we stayed clean, so we were sure to stay clean. But they don't have enough tests right now. But they're back ordering nasal swabs, so as soon as the nasal swabs come in, then EMS will be in to test. Yes?
Promise, last question.
Yeah, that's
So let's
okay.
say if a resident has the test,
Yes.
and we don't have like the 45-minute rapid response ones yet. Now, let's say there's a time period of 5 to 6 days to find out the result.
It should be 24 to 48 hours.
24 to 48?
Yes.
Okay.
And we can expedite that time, or not time, but expedite to the top of the list for testing.
Because of where we are.
But this is 24 hours, the people
Yes.
who have work patients are going to be asymptomatic.
Well, we're going to put them in push those patients in droplet precautions. Yes.
So you'll know before
We are more concerned about that.
Well, so if beforehand, if they have respiratory issues, then yes. And since we aren't bringing visitors in, you know, if we have anybody, we are currently testing 1 patient at the moment. But if we have, she's been in the building for 12 days now. with no visitors. And usually symptoms appear between 5 to 8 days. And she's responding to antibiotics as well. So that means that it probably, 75–80%, it's not the virus. It's something bacterial that's causing her to spike her fever and to have respiratory issues. Yes, ma'am.
I can't remember where I heard it, I don't know if it's true or not, but they were talking about large capacity hotels, making them into hospital rooms and everything.
They are thinking about everything, anything and everything, because we have a very large geriatric population, in case you guys didn't notice. But
And that would be the best way to.
What are we doing to protect like our dialysis folks who get, they leave the facility, they're on public transportation or leopard transport, go off, who knows who they come in contact with? Are the facilities and the transport drivers taking extra precautions to...
So the dialysis patients, when they go out, are to wear masks. And they're supposed to keep masks when they go, and when they come back in, we're supposed to, disinfect the wheels of the chair, their shoes, the wheelchair itself, so that we can try and prevent anything from coming in with them.
But it sounds like we're saying the masks are protecting the residents when we're wearing them, not necessarily protecting ourselves. So somebody going out wearing a mask...
It's doing both.
Okay.
It's protecting us as well. Yes, it's doing both. But yes, the guidelines from CMS is that dialysis patients, when going to dialysis, are to wear masks. And they're well aware of the N95 shortage. In fact, the EOC, I have been supplying you guys, we've been supplying you guys with masks by getting them from local doctors' offices, by, getting we've been very creative at making sure that we haven't ran out of anything. Now, there's a possibility that we'll run out of bleach wipes, and if we do, we can use bottles with washcloths. So bottles of bleach solution with washcloths, that's perfectly okay. Spray the cloth, wipe it down. That will do just as well as the bleach wipes, although the bleach wipes are very convenient. And our suppliers, so also the emergency management called today and said that they just got a supply of some supplies in. Tell me what you need. So I gave them a list.
Okay, you just brought up the point of the shoes. I mean, with us walking on those creation and all that.
I'd suggest you change shoes or disinfect them. Now, we're constantly...
Bleach wipe your shoes.
Just bleach wipe them, yeah.
At home, what I do, this is exactly my routine when I get home. I go directly to my garage, separate from the house. If I have a laundry area, I go ahead and put my clothes in that laundry area, then I make my way to the shower. Don't go home and sit on your couch. Don't go home and lay across your counters. Don't go home and touch your refrigerators without disinfecting yourself, okay? Because what that does is you put everybody in your home at risk. Every morning, my wife makes sure I do this. She's Latin. She wants to keep me tight. She says, hey, you take that Fabuloso and the water mixture I got for you, spray your shoes off. Wipe them down, put them on, you can go. Before you come in the house, she's waiting on me with a bottle. She sprays me down, I wipe them off, put them at the door. I don't bring them back through the house. I go do what I gotta do, okay? It doesn't matter where you walk, where you squawk, or where you talk. You can always be exposed to this. The best thing that you can do is use your PPE, which she's providing for you, and keep yourself at a safe social distance, all right? Except for your folks who are at home. If you're in the building, this is a safe zone. Treat it as such. Just like it's on a battlefield, this is the home base, okay? Anytime you guys start any kind of crazy rumors, speculation, or cause fear, it's gonna ramp. It's gonna run like wildfire. And I learned today with some quotes.